peritoneum is a large membrane that lines the abdominal and pelvic cavities and covers most abdominal organs. The abdominal cavity is usually empty. The peritoneum contains many blood vessels. The peritoneum acts as a semi-permeable membrane between the blood and the abdominal cavity. Blood is full of tiny particles like cells, proteins, vitamins, and so on. When someone has kidney failure, there are also numerous toxins in the blood that are normally removed by the kidneys. During PD, the peritoneal cavity is filled with dialysis fluid. Dialysis fluid contains a high concentration of sugar so that excess water can be removed from the blood by osmosis. The dialysis fluid is left inside the peritoneum to allow dialysis to take place. During this time, excess water and waste pass from the blood into the dialysis fluid. The used fluid, containing the water and waste that the kidneys would normally have passed into the urine, is then drained from the body and replaced via the PD catheter. Peritoneal dialysis, or PD, is a type of treatment for kidney failure that removes excess waste and water from the blood across the peritoneal membrane in the abdominal cavity. PD uses the peritoneum as a natural semi-permeable membrane. The excess waste and water cross the peritoneal membrane into a special dialysis solution and then leave the body through a tube called a catheter. A tube called a catheter is placed in the abdominal cavity during a minor operation. The peritoneal dialysis fluid enters and exits the abdomen through this catheter. The skin around the catheter must be cleaned regularly to make sure it doesn't become infected. Your dialysis nurse will teach you how to do this.